Great question. A periapical relucency occurs, for example, in this case, that is called a periapical relucency. Okay, so periapical relucency occurs when you have a necrotic infected tooth, and the reason for the necrosis of the pulp tissue is microorganisms. So somehow microorganisms got inside of the sterile environment of the root canal systems, and they used the pulp tissue for food and multiply, and they produce all kinds of nasty chemicals, hormones, and toxins and endotoxins, and all of that gets pushed out to the outside of the tooth, which causes an immune response, and all of that activity will cause bone destruction. And you see that in the form of these dark shadows that form around the end of the roots, and we call those periapical radiolucencies. Sometimes a periapical relucency, again, bone destruction, jawbone destruction, that's one right there, happens after the root canal. So root canal is done. Somehow, again, bacteria gets inside of this supposedly sterile environment. It's supposed to be sterile. And for example, if the dentist doesn't use a rubber dam, saliva and bacteria from the patient's mouth can get inside of this space as the dentist is doing the root canal. Or if the dentist refers the patient to an endodontist, the endodontist uses a rubber dam, refers the patient back to the dentist doesn't use a rubber dam to build the tooth up and crown it, introduces saliva and bacteria inside of the tooth, infects the root canal that the endodontist did, and over time will cause periapical relucency, again, bone destruction because of presence of microorganisms.